which we want to inform the general public. இதில் என்ன அட்வான்டேஜ்னாக்கா I will mix both Tamil and English so that everybody comfortable. இதில் என்ன இது அட்வான்டேஜ்னாக்கா that patients who have long, I mean degeneration, suppose arthritis ஆட்டம் முட்டியில் mainly ankle or இது முட்டி இருக்குங்க, knee joints, all these things we can now different kind of treatment we started. இதில் வந்து main advantage is that we can do a daycare procedure in a small arthroscopy use பண்ணி we use the pathology, we sort it out basically. என்ன ப்ராப்ளம்னா தேய்மானம் இருக்கிற இடத்துல மாத்திரம் we put the cartilage, from the non-articular portion. I will show you in this. To see this is the normal knee joint and the bone is covered with cartilage, and the cartilage doesn't have any pain sensation and it's also smooth. So the movement will be very pain-free and also very smooth without any friction. But once the cartilage wears out, there is a bone exposed, and that bone exposure causes the pain. So if it comes out from the top bone and the bottom bone, when they rub, it's like walking on a broken bone. That much of pain will be there. So basically, the cartilage is the most important part in this one to cover the bone so that it lasts for as long as possible. But when this wears out, when the cartilage wears out, that is causes the beginning of the arthritis. So the wear and tear will continue to become more and more, and it will cause much more defect. And then when it becomes more in the joint, in all the three compartments, then there is no other way to treat it. We have to go for a replacement so that the bone to bone touching is not there, so that the movement is smooth. That is what happens in a knee replacement, where the surface which is damaged is put with a metal, then another metal covers the top bit of the lower bone, and the cartilage is replaced with a plastic one, polyethylene. So the movement is smooth and they don't get any pain, and also the alignment will be corrected. But this is the final stage of the doing in the arthritis. But before that, if we can preserve the bone, that's what we try to do. Like most places, if the bone is natural and if we can natural cartilage can cover it, the pathology would be controlled here. So this several times, it started about 40-50 years back. They started to take the cartilage out, and then we tried to put it back. But the culture, they have to do it outside. Take the cartilage from the bone, from the joint, then keep it out and they culture it and make it bigger and grow and then put it back. These are all the olden standard, where 2-3 times the operations, and then they needed a lot of crutches and all those things, aids to walk. But here, what happens is, what we do is, this is the weight bearing area, and then we fix that with a fibrogen glue, which will act like a glue and it gets fixed there. Then we give the stem cell, which is, the PRP can be given as a stem cell. That is a platelet-rich plasma. And these cells have the capacity to increase the growth factor. So this will cover the damaged cartilage, will be covered with the new cartilage we taken from the side. And the PRP will increase the growth of the cartilage. And over the years, it repairs the thing. And this achievement will postpone your knee replacement. Also, if you are careful, it can go on as long as possible. So this we do it with certain patients who are young and fit for this, because every patient cannot be done with this. Not that it is a complete change for a knee replacement. The indications are very, very limited in this one. Very important that the joint has to be straight and in the early stages and with the minimal damage we have to do it. So the selection of the patient criteria is very, very carefully done, and it cannot be done for everybody and then it will fail. So we do it for the young patients, active patients, and minimally damaged. But our patient who had this, we were waiting for the long-term results. Suppose we do it and 1 or 2 years, if with the PRP and with the changes, it may help. But we wanted to wait for 5-year follow-up to present it as it is an alternative in the beginning stage. Suppose if this goes wrong, if you ask what happens next, we have the option of knee replacement. So the idea was to avoid knee replacement as much as possible because that is the last resort. And if even a knee replacement fails, it can be revised. But we don't want to do anything big. This is a daycare procedure. That means we take a small hole, we make a small nick there and put a scope which is about 6 mm to 8 mm, and through that we do all the things, how we take the graft and then we place it back in the place where it is defective is there. Other advantage is that we don't need any brace or any walker or crutches or anything like that. We can make them walk same day. They come in the morning after the surgery, after 3-4 hours. It's a daycare procedure, they can go back. Then, but the result, it will take time, about 3 to 4 months for the cartilage to incorporate, and it helps. And we've done about 30 to 40, 35 patients till now, and we are following up, and we are also publishing it in a journal now. With this is a good one for young and fit. Damaged, but those they don't want to go for a bigger surgery and knee replacements and all. We can avoid it in those patients. Here, this patient of ours got it done in the year 2020. So now we got about 5-year follow-up. So we wanted him to tell how he himself he can tell what was his problem and how he came out of that.
I was having the severe joint pain, knee pain from 2015 onwards. Due to my wife critical condition, I am not able to take severe treatment. After taking the treatment, many hospitals they told that finally after taking their medication, they want to replace the joint. But my condition is I am not able to do that replacement because of taking care of my wife, who is she was done in bilateral lung transplant patient before COVID. Then I come to know that one of the friend he told that Dr. Nandakumar from his Fortis hospital at the time. Then just I came and met him. He advised. He also taken that MRI and other things. He want to maintain the medication. Then after that also some severe pain. I asked sir. Other hospital told that this age you have to do that better for knee joint replacement means very easy for future. But he recommended that if you are accepting stem cell technology, he told. I don't know that stem cell technology. Stem cell means when the child born at the time they will take the stem cell, they preserve that they will do the treatment like that. I heard the knowledge. Then he told that no, that is only one day daycare only. You come in the morning and evening you can go. We will take care like that. Because of that confidence and given by friends only, I accepted the treatment. Then 2020 I taken the treatment. Only one day, morning admitted and evening, and within 4th day I was normal to going to my office day-to-day work. Basically, I am always traveling and in the site I am moving, walking maximum time. But now I am feeling better. I took that around 1 month only that severe exercise and medication. Then after that bone strengthening medicine supplementary he has recommended. 2-3 years I took, but now I am not at all taking any medicine. Now is okay now. But at the time I was doing that surgery was around 79 to 80 kg. Now I am having 89, but still doctor is advised to reduce the weight for better for sustaining the things. I am trying my level best. But this one is the new things I told to my friends also. But no one has believed stem cell. Where is we will get the stem cell? But he told he take that during that operation itself he shown the process. I have seen the process what he has done. That was the things. Now thanks to this hospital who has taken care of my joint, replacing the joint. Without this replacement of the joint, but taking care of the stem cell technology, I am still sustaining. No pain, nothing. I am doing the day-to-day work well and good. No, local anesthesia.
Spinal anesthesia, so that locally it will act, below the waist level it will be anesthetic, and they can also see the procedure. I mean, if somebody wants it, we allow them to even have a look because it's all done in the monitor. I'm going to put it up here to show what we did, basically. This is, but இது வந்து எல்லாருக்குமே யூஸ் ஆகாது. I mean, certain criteria we have to follow. ரொம்ப strict criteria we have to follow. Then it will be very useful and it will work because we are going for the pathology. என்ன ப்ராப்ளம் வந்து அதை சால்வ் பண்ணுறோம். கார்ட்லேஜ் டேமேஜ் வந்ததை நாங்கள் ரீப்ளேஸ் பண்ணுறோம். With the cartilage from the patient. So it is an autograft. That means patient irundhe adhe joint irundhe eduthu ange podrom. So that is a real easy one, good one. and we waited for 5 years because 1 year, 2 year, எல்லாருக்குமே வரும். Suppose he had some steroid injection earlier and all by some other center, and that will help, but that will cause a lot of damage. So we don't put steroid inside a large joint. We should not do that. But in the cartilage transplant with the stem cell and following it up has done wonder, and I wanted the people to know this is also an option. People can benefit with this itself, and it's a much simpler procedure, you know. And if this fails, always, I mean, we can go for a definitive procedure like a knee replacement and all. Madhya Pradesh, he visited, so he is one of the long-term follow-up, so we asked him to come. Other people also said there is a very good support, I mean, healing, and they are pain-free up to about 80%, I think. You know, we are publishing. This is our assistant, and she's also done the, all the enquiries and the public. We have sent it for publication now. So we thought it is quite encouraging, and we can share with the public.
And you request a total permanent solutions.
Ama.
You went for this. What is the reason you went for this?
Adan, because இது வந்து இப்போ இவர் பாருங்க 5 years without knee replacement he is fine. He has no problem. He is climbing stairs. His job is an engineer, so he walks around and all. So we want to avoid. Main aim is to preserve the bone and quality of our natural thing, what God-given thing. We cannot, even a knee replacement will work fine, but it cannot be as good as what naturally we've got, you know. So that can be kept as the last moment. I mean, இதுமே ஃபெயிலியர் ஆக்சுவலி ஒன்றும் ப்ராப்ளம் கிடையாது. இதில் ஒன்றும் ஆகலைன்னா ஒன்றும் டேமேஜ் ஆகிடாது. ஜாயிண்ட் ரீப்ளேஸ்மெண்ட் பண்ணுறதும் ஒன்றும் அவ்வளோ டிஃபிகல்ட்டும் கிடையாது. அதனால் திஸ் ஷுட் பி ட்ரைட்.